This is the Emergency Medical Minute, sponsored by Health One.
Despite all the construction and all the other hassles we've had here, I think we have a pretty good, work environment, a pretty good setup for, the systems we have. We get interesting patients from EMS. We're able to move patients through fairly quickly. We don't have, I don't think, terrible system problems here, but, psychiatric patients do present a little bit of a burden to the emergency department. It's not unique to us, but it is something that, we get psychiatric patients who don't need a lot of medical care. They just need a quick clearance, but then they end up staying here for, sometimes days waiting for psychiatric placement. So I was, looking at a study recently that made me think, wow, there's something that could be way better out there. And there's this idea that in certain cities, certain systems, there are psychiatric receiving hospitals that take patients directly, and there are certain systems where EMS patients can make calls on whether patients need to go to the emergency department or they just need to go directly to a psychiatric hospital. And this was a study out of Oakland, Alameda County, where they have a system that EMS can see patients, decide whether they are clear for psychiatric facilities, and bypass the emergency department. And the study showed that of the patients that needed to go to a psychiatric facility, 40% of them were cleared by EMS to go directly to a psych facility. And they looked at, how many of the patients actually ended up getting, bounced back to the emergency department. Did EMS miss, an acute medical condition like a head bleed or a bad infection? And only 0.3% of the time did they have to get taken back to the emergency department. So obviously the system can work, and, a lot of the patients that we see that are just, I'm suicidal, I'm off my meds and I'm paranoid, that we do very, very little for, could potentially go directly to a psychiatric facility. And, I think that hopefully there's, some people at a policy level that could look at, how does Denver, city come up with a resource system that we could come up with something like that. So it's inspiring, and I might pass it on to somebody who has, bigger abilities to make this happen, but maybe someday it would be nice. Any questions, thoughts? All right, well, thank you guys.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.